I really hope people watch this because this is a pain in the ass to set up. Hi everyone, my name is Persephone and today I'm going to be talking about my experience with a bone infection called osteomyelitis. So if you're interested in hearing my story, stay tuned. Just as a disclaimer, I am going to be including photos of nasty, deformed feet and also my PICC line, which I'll explain more of that later, but it is basically an IV that goes into my arm. So if you are squeamish about any of these things, I'll be sure to leave timestamps so you guys could go ahead and avoid those if you don't want to see the photos or the video of my PICC line. But otherwise, I hope that you enjoy hearing my story. So just as a bit of context, I am 23 years old. I just turned 23 in February. It is now March. So I've only been 23 for a very short amount of time. And I have no pre-existing health conditions before this. I mean, I've always been a sick child, but nothing obviously so bad as to warrant a bone infection. So just as some background information. So where we all began was actually in mid-December. On my right big toe, I realized I couldn't completely flex it down. Like, you know, I'm so used to having monkey toes where you can like pick up things with your toes. I couldn't flex my toe down completely. It was just kind of stuck straight. So it really felt like I had to pop it, you know, like how sometimes your joints just get stuck and you feel like you have to pop it. Normally I just like bend my toes down for that, but for some reason that wasn't popping it. And so I just kind of let it be, and maybe thinking like, the tendons around my toe, my joint are a little tight or something, I don't know. So I just let it go for a little bit. Eventually I got so tired of it that just one night I very gently pressed my big toe into my mattress to just bend it down, and it popped. You could hear the pop. And I was very satisfied because I could bend my toe again and it felt really good, and I thought that was the end of it. Except that I woke up the next morning with my toe completely swollen. And so I was not very happy. I was unable to wear shoes very comfortably. I did work at the UPS store, so I had to pick up, you know, 50-pound boxes almost every single day. So it just really put a lot of pressure on my toe. So after a couple of days of like, swelling not going down with like anything, I went to urgent care. When I went to urgent care and I told the doctor this entire story about me not being able to flex my toe completely, about me pressing it into the mattress to pop it, he basically told me that it was the most ridiculous story he had ever heard. He instructed me to get an x-ray, but he really just thought it was sprained. So he just kind of gave me like a really thick plastic shoe to put my feet in, so that way my toes wouldn't bend and I wouldn't hurt the sprain any further. I did end up going and getting an x-ray, and the radiologist determined that there was no break or fracture and that it was probably just a sprain. So I just wore that boot for a while. So whenever I looked up like a sprain, I read that it was like 3 to 6 weeks for it to recover. And so I was kind of like, it sucks, I could hardly walk, I can't wear regular shoes on my foot, I have to wear this like dumb looking boot. So I was not very happy, but after about a week or two of wearing that, I realized that my toe wasn't getting better, it was actually getting worse, that the swelling was going from the joint of my big toe down to the ball of my foot, and I knew that wasn't what usually happens in a sprain. I forgot to mention that the urgent care doctor did give me a referral for a podiatrist, but I thought that was unnecessary. I thought that was like really excessive, especially since he just thought it was a sprain. Like, why would I have to go to a podiatrist for a sprain? But whenever it did get worse, I did decide to use that referral for the podiatrist. When I went into the podiatrist, I showed her my x-rays and she said, there's a little bit of like an abnormality. Like, I'm not sure if it is like a tiny fracture or what it could be, but we're gonna go ahead and just treat it as a fracture in your toe. So I was like, okay. So I got a giant walking boot. I'll insert a photo of what my walking boot looked like whenever I was wearing it. It's huge and so heavy. But I did wear that. She said to wear it for about a week. She like wrapped up my toe with like a compression bandage, like an ACE bandage. And she said, just wear that for a week, come back, and then we'll see about what happens next. It should be totally fine. I go back in about a week. I hated wearing that because I had to wear it 24/7. I had to wear it in the shower. I always put like a plastic bag over it. It was heavy. I had to wear it while sleeping. It sucked so bad. But I went back in a week and it was not any better. She was feeling my joint and it was still very painful. So she was really confused about that. She decided to splint it. So she wrapped it really tightly around with the toe next to it. And told me to wear it for 2 weeks. So again, I had to wear this heavy boot with my toes completely bandaged up for 2 weeks, 24/7, and that was even worse. At this point, I had asked for a doctor's note to excuse me from work because I was trying to work on it, but like I said, I lift like 50-pound boxes. It was just not working out. Every time I would walk, because the boot was so thick on the bottom that it was kind of messing up my hips, and so my hips were really hurting from the unevenness of my feet. So I did wear like these little wedge tennis shoes to kind of like even out the height of my legs a little bit. And then I started noticing while I was wearing this that my other toe started hurting. I thought it was because of the pressure, like it's basically like wearing a heel, but like in a tennis shoe form. I thought it was just like the pressure of the toe against the foot that was causing this. So that's why I asked for the doctor's note. I didn't want to wear these wedge tennis shoes to work anymore. I just wanted to stay off my feet for a little bit. And so she approved it. My boss gave me the time off and I decided to apply for disability, you know, all those things. And I thought I would get better within like the 2 weeks. Oh, one more thing is I'm pretty sure I don't have my journal here. I've been writing down like all the important events of this. My journal psych, I don't have it right now. I don't know if this happened before or after, but my podiatrist did ask that I go get an MRI. So I'm not sure if it was during the 2 weeks in which I had my toes splinted or if it was very shortly after. But all I know is that like after it being splinted, generally that would help a fracture because you're not moving your toe at all. It was still really painful, and I started having the pain in my other foot too. That didn't go away after me being off my feet for a little bit. So my podiatrist did authorize an MRI in my right big toe. So I went in for the MRI, thinking, I don't know, like a show of fracture maybe. I wasn't sure what was going on, neither did my podiatrist. I was so anxious for these MRI results that whenever it got put up onto my chart, like on my online chart, I read it, and although I'm not a medical professional, I did like reading a lot of medical books and journals and things like that. So I decided I was going to just read and look up what I didn't understand. And whenever I was looking it up, my heart sunk because what they were saying was it looked like I had either septic arthritis or osteomyelitis in my toe. Both of those were really foreign diagnoses for me. Whenever I looked up septic arthritis, it scared me so bad. Basically, it was saying that like if untreated, I could die because of sepsis, I'm assuming. Osteomyelitis was also really bad. It was just a bone infection, which also, if untreated, like both of these were really, really serious diagnoses. And like 45 minutes after I had read these on my own, my podiatrist called me immediately. And she's just like, you are showing you have a bone infection. You need to go to an infectious disease doctor like as soon as you possibly can. So she referred me. I got an appointment for like, I think she called me on a Friday. I got an appointment for that Monday. So it was very, very quickly after I got my MRI results that everything started happening. Because with the bone infection, you don't mess around with it, which I didn't know anything about bone infections before. So typically a bone infection is contracted whenever there's an open wound on the skin and bacteria goes in there and it just infects whatever's inside, the blood, bone, whatever. I had 0 open wounds on my feet whenever I popped my toe and like thought it was a fracture. No open wounds, no sores, no nothing of the sort. I have absolutely no idea what caused it, and I still don't. And neither does my infectious disease doctor, neither does my podiatrist. All of this is just a big old mystery about how I got this bone infection. So I was not very happy with these diagnoses. I was really scared. Like, you know, when you say infectious disease, it's really concerning. Previously, I talked with my podiatrist about this potentially being like arthritis, like a inflammatory arthritis, like rheumatoid, something like that. The blood test I took did show that I was negative for all those types of inflammatory arthritis, so I guess that's good. I guess it's not like a lifetime thing, but it's also a lot more serious for it to be a bone infection. I'm so sorry, I keep having to rewind because I keep remembering new details, but whenever I had met with my podiatrist after like the splint didn't work, I had noticed something else very, very concerning. So this was regarding my left foot. I mentioned previously that I had a little bit of pain whenever I was wearing those wedge shoes, but the pain wasn't going away after I staying off of it. Because of the pain in my foot, I guess I started favoring walking on the outside of my foot more, which is not good. I'm already pigeon-toed, so that means I walk with like my feet turned in, but I started favoring that, so I was walking even more like on the edges on my feet, which is not good. And what ended up happening was I was doing that for so long that my ankle became very inflamed and it deformed my foot entirely. So my foot was kind of stuck in a constant state of being turned upwards, like with the side of my foot, the flat side by my pinky, basically being always pointed towards the ground. And it was just stuck there. Like I had no ability to like straighten it out. I couldn't walk flat on my feet whatsoever. That was really, really concerning for me. It looked hideous. It was really painful. I couldn't walk, obviously, which my podiatrist thought was weird, but she didn't really do too much with it because she was more concerned about what was going on with my right big toe. She was thinking like, whatever's wrong with that, it's probably also wrong with your other foot. Just a little information about that. I'm going to include a photo of what my feet look like because it was, yeah. So anyways, I go in to the infectious disease doctor on Monday, and the infectious disease doctor was like roaring to go. Like he's like, we got to get this thing knocked out. He wanted to be really, really aggressive with it, which understandably so. Like it's a very serious thing. He said that I would have to be on antibiotic therapy, like intravenous antibiotic therapy for 6 weeks in order for me to get this infection flushed out, basically. So he kind of discussed like what I could do. Either I could self-inject, which terrified me because I don't think I could do needles, or I could go into an infusion center every single day, the same time every day, without fail for the next 6 weeks. When I don't drive, I have severe PTSD and anxiety. I cannot physically drive. So that wasn't gonna work. But even if I did know how to drive, both of my feet were in such pain and I couldn't do anything that I wouldn't have been able to drive regardless. So for me to be able to go to an infusion center 6 days a week, or 7 days a week, sorry, every single day without fail was kind of difficult, since I'd have to either Uber, which is expensive, or I would have to find someone to be able to take me every single day. So while I didn't like the idea of self-injecting, I thought it would probably be a good idea to do it. Regardless, he said I would have to get a semi-permanent IV line put inside of my body in order for me to get the medicine. So he scheduled that super, super quickly. It was insane how quick. I had left the doctor's appointment around like 9 o'clock on Monday, and by the afternoon he had already scheduled it for the next day. So it was very, very, very quickly that it happened, which is so frightening. Like, I went from one day thinking that I just had a little bone fracture that was just going to go away to a very serious bone infection that required a semi-permanent IV line for 6 weeks. It was a huge amount of change in my life in such a short period of time. So I go in the next day for a PICC line, which is like, I don't know if, I guess it might be considered like a little small, like surgery. Like it's very, I wasn't sedated or anything like that, but a really skilled doctor had to come in order to place it. I go in, they gave me a warmed blanket, which is amazing. But the doctor came in, and yeah, I don't really know how to describe the procedure very well. He has a long tube, and basically this tube is going to be put into my arm and feed all the way to my heart. I'm going to place a little diagram of what that looks like. So basically it's in my arm here, goes all the way up my shoulder, around and down to like basically like the top of my heart, which is insane, like very scary. They also had to have like a little like monitor on my chest. I'm thinking it was kind of like an ultrasound type of thing, where they could like see the location of the line in accordance with my heart. I'm pretty sure they also did like an ultrasound of my arm to find the vein that they were going to put it in. So all this was like really weird and interesting, but it didn't hurt at all. It wasn't painful. It didn't make me queasy, which sometimes like blood and like surgical things can, but it was a really, really easy procedure. And I basically went home with just a thing coming out of my arm. I did decide to do home injections, which I did discover afterwards wasn't going to involve a needle. Since I have this PICC line, it was going to just be syringes without the needle, and I just put it directly onto the PICC line and feed myself a medication that way. I would also be assigned like an RN who would come take my blood every week. So yeah, I figured that would be the best option. It would eliminate my need to have to drive out 7 days a week, every single day. And there was no needles involved. So like, what's the worst that can happen? My heart's going so fast and I don't know why. Okay, anyways, I'm gonna show you what my PICC line looks like. I got a fancy new clear bandage because my skin was irritated by the adhesive. But this little entry point right here is where it goes directly into my body. So this is a direct line to my vein that goes directly to my heart. So it's very, very like serious that I keep this very clean. I follow the procedures for my medicine taking every single day. Like everything has to be sanitized, sterile. Like it's a whole process that I have to do every single day in order to make sure I don't get a PICC line infection or a blood infection or like anything serious. I mean, one of the things that my home care nurse told me when she first came here was if I get blood in my, or not blood, if I get air inside of my vein, I could have a pulmonary embolism, which is a heart attack. So you could imagine my anxiety thinking like, okay, she's just gonna leave me after today and I'm gonna have to do this from now on. But she was a great teacher. I learned a lot and nothing bad has happened. So that's good. So yeah, I started my antibiotic therapy as soon as Tuesday, which was when I got my PICC line in. And every single day after that, I just took my medicine. And my left foot was obviously still deformed. I still couldn't walk on it. My right foot, the pain was mostly in the ball of my foot and my two toes, like my big toe and my secondary toe. I don't know what it's called. Like my index toe. So I couldn't do anything. I had to extend my disability for work. I basically just laid in bed all the time. And I don't live in an accessible apartment. I live on the 3rd floor of a building that doesn't have an elevator. They only have like these outdoor stairs. So you can imagine how difficult it was for me to get up and down. My boyfriend, oh my gosh, I am so lucky and grateful and blessed that I have him because he would carry me up and down these stairs so often. I'm getting a little choked up thinking about it. But he would carry me up and down just for me to be able to go to doctor's appointments, to do anything, you know, like I couldn't do anything by myself. And he would also, I'm so sorry for getting emotional, but it's such a huge thing to go from one day being really independent and being able to do everything yourself, walk by yourself, to now having to be reliant on someone else and having that person actually be able to and want to help you is such a huge, huge thing. But he would even carry me to and from the bathroom. Like he would take me from the bed and put me down on the toilet and wait for me to do my business and take me back and put me back in bed. I'm so, so grateful to have someone like that in my life. Anyways, it took me about like a few weeks, maybe like 4 weeks approximately, for my ankle to start getting a little bit better. I will mention that my podiatrist did go ahead and schedule an MRI for my left foot and ankle just to see if like the same kind of thing was going on there. It did confirm that I have a bone infection in my ankle and my foot on my left side. So now I have a bone infection in both of my feet. This was both comforting, but also terrifying. I spoke to my infectious disease doctor after we confirmed it. And he said in his 28 years of being an infectious disease doctor, has he never seen a person of my age and my health have a bone infection in both of my feet. He says typically this was seen in like elderly diabetic patients who have like constant sores on the bottom of their feet. The infection goes in, they have sores on their other foot. The infection gets in that way. That's like really the only time he's ever seen a bone infection in both feet. I, however, had nothing. My infectious disease doctor says it's totally unheard of to have a bone infection in both my feet without it either having an open wound on both my feet or having a blood infection of some sort. And if it was a blood infection that just like the infection went through and just settled in at the feet, one, I would probably be a lot worse off because obviously a blood infection is really serious. I would have symptoms of a blood infection like fever, nausea, like all the type of like typical stuff of an infection. Even my white blood cell count was totally normal, which means that my body didn't determine that there's an infection in my body at all. Even a bone infection, just still kind of interesting and weird. But he also did a blood culture and there showed nothing in my blood culture to indicate a blood infection. So he's completely and totally mystified by me. He's so confused. I am confused, but all we know is that the therapy is working and that's why we're going to continue. So, but yeah, anyways, my left ankle did start straightening it out after a few weeks of antibiotic therapy, which I was so grateful for. My foot is no longer deformed. It's straight. I'm able to kind of make it straight again, but I'm still like struggling to walk. My right foot, the infection's right on the ball of my foot, so I'm still unable to really walk flat. I'm trying to stay off my feet as much as I can, but I'm walking a lot better than I used to. I'm just so glad I'm able to have some sort of independence back. I'm able to go to the bathroom by myself. If I wear both of my protective boots, I'm able to go down the stairs by myself, just very, very, very slowly. So I'm really glad to have some sort of independence back, but my feet are still obviously healing. I'm still on my antibiotic therapy. Last week was my 6-week mark. Unfortunately, at the time, my numbers, my inflammatory blood results show that they actually been up a little bit, which was so terrible. Like, my numbers were almost completely normal, and once they hit normal and they kind of stay in normal for a little bit, I could get off the antibiotic therapy because, I mean, my blood work is normal and I'll just continue to heal. Except it bumped up a lot. So just as some context, maybe someone is a nurse or medical student or something and is kind of interested in the numbers, there's two main tests they look at in my blood. There's SED rate and C-reactive protein. My C-reactive protein, the normal is less than 10. I believe I started out at 90. And the SED rate, the normal is less than 30, and I was at 111. So that's how I started out. Thankfully, once I started my antibiotic therapy, they were gradually going down. I think right before they jumped back up, my C-reactive protein was at 19, so almost below 10. And my C-reactive protein was, and my SED rate was in the 30s, so it was almost below 30. I can't remember the exact number, but it was so close to being a normal, and then they bumped back up. My C-reactive protein jumped up to 22, and my SED rate jumped up to 70, so that's quite a big jump. But I was very close to being off my antibiotic therapy, but it's been extended for another 2 weeks. Very high chance of it being extended for another 2 weeks, therefore making my antibiotic therapy 10 weeks. But I'm still getting better. I definitely feel an improvement in my feet. And I am just working every day to try to get better. So obviously the story isn't complete since I'm still on my antibiotic therapy, but I just wanted to start my story since it is quite a long-winded one, as you could tell. So I just wanted to get this out there. I'm not going to be showing how I take my medicine or anything like that because I'm not a medical professional. I'm not a registered nurse. So I don't want people to see this video and take it as medical advice. If you ever need to have a PICC line, rest assured that either someone will do it for you or someone will teach you the proper ways to do it. But yeah, I'm not going to be showing that process at all because it's just not my place to do so. It's really boring to watch too, so. But yeah, all of this is just to say that this experience has been terrifying and really just terrifying. But it also has made me appreciate a lot that, you take for granted a lot. Being able to walk, being able to go to the bathroom by yourself, being able to go downstairs, being able to work, like all these things I really took for granted before now. Oh, having a wonderful boyfriend, like all these things you don't really think too much about until that's all you have or you don't have, So hopefully making these little YouTube videos will help me with keeping my time occupied while I go through my antibiotic therapy and afterwards probably physical therapy so I can actually learn to walk again and get my strength back. So yeah, I hope that you'll maybe enjoy some of the stories I have to tell. Maybe we'll do some more because I have a lot of interest. But yeah, anyways, again, my name is Persephone, and thank you so much for watching.